Dr. Allen, tell us a little bit about yourself.
Sure. I practice as an academic hospitalist in a academic medical center. This means that I'm a general internist by training. And what I do is when I see patients only who've been admitted to the hospital for general medical type of issues, pneumonia or renal failure. And because I'm an academic hospitalist, what that means is I work with residents and students, and all of my work is by teaching and supervising what they do in their medical care. I do this for about 25% of my time in terms of my clinical care. I spend another 25% of my time on research in patient safety and medical malpractice type reform, and the balance of my time is spent on improving quality and safety in the hospital.
So you work with hospital medicine.
Yes, I am somebody who practices hospital medicine and work as a hospitalist, correct.
And what about you? Were you born in America, born and raised in America? Tell us a little something about you.
Sure. So I'm an American. I was born in Chicago and raised in Los Angeles in California. I've moved around quite a bit for my education and my training within the States, and now I currently live in Boston.
All right. What can you tell us about job opportunities for hospitalists in the United States and the perspectives for the future?
Sure. This is currently a great time to try to become a hospitalist. When I came out looking for jobs about 5 years ago, jobs were available. But when I look at the market today, there's an insatiable demand for hospitalists in the academic and the non-academic settings. This is a great time to look for a job as a hospitalist because the hospitals can't get enough people to help do all the work that's needed.
What is the difference that a hospitalist do for a hospital? What's the difference? What makes a hospital want a hospitalist?
Sure. I think there's a couple things that make a hospital want a hospitalist. One is our availability. Our jobs are designed so that we're always on site, so that if a patient has a difficult situation that arises out of nowhere or somebody needs help with a patient, because the hospitalist is always on site, they can show up within a few minutes. I think another thing that really helps a hospital want more hospitalists is the fact that hospitalists do this day in and day out. They take care of patients on the inpatient side. And just as we know in other specialties where surgeons who do the same procedures over have lower complication rates, we believe that by doing inpatient care over and over again, you can have better outcomes with hospitalists.
Can you tell us a brief story about hospital medicine at Brigham and Women's Hospital, and relying on your own career case, can you show us the advantage of hospital medicine at your hospital?
Sure. I think this just ties back to the last question here in terms of when patients don't do well, the residents or the nurses can always page the hospitalist who's on site, who can always come and give help right away. And because this is what they do for their clinical careers, they tend to become specialists in this area. Even though they're generalists, they can do a very good job of providing the care that's needed in a timely fashion.
In our country, some people are confused, thinking that hospitalists are the same as doctors who work in rapid response teams only. How can you differentiate one from the other?
So first of all, I can understand how people might get mix up the two, because people who are in rapid response teams are always in the hospital, and hospitalists are always in the hospital. I think the distinction comes in the function that they provide. Hospitals are there to provide longitudinal care throughout the hospital, whereas a rapid response team is a special team that's designed by the hospital to respond rapidly for any service, regardless of what service the patient is on, to help save a patient when something goes wrong with them in a hurry. Now, a hospitalist can serve as somebody on a rapid response team, but a surgeon could be on a rapid response team, a specialist could be on a rapid response team. It's more about the function that they provide, and they provide very different functions.
The patient safety movement is developed, and there is a growing recognition of its importance. How do you work this concept at Brigham and Women's Hospital with residency programs and in Harvard Medical School?
Sure. As we talked about, the patient safety movement is gaining a lot of interest in the States. It continues to garner a lot of interest. One of the things that we've realized that it's very important to get to residents and students in their training to explain them the importance of this area. So much like they learn GI or pulmonary diseases or infectious diseases, what a lot of us are doing is trying to expose people at their educational level so that there are often classes provided for Harvard medical students on patient safety and how to improve patient safety, and residents have the same types of lectures. We're very fortunate at Brigham and at Harvard that we have a lot of people who are leading experts on fixing these types of mistakes and write a lot about it, so they're available to teach and inspire these residents and students. At Brigham and Women's, additionally, a resident, if they want, they can actually enroll in a rotation in which they would learn about patient safety and how it's improved in the hospital. So we're just trying to get to them when they're younger and show them what opportunities are out there.
So how was your stay in Brazil? What impressed you the most?
My stay in Brazil has been absolutely wonderful. I'd be hard-pressed to say what impressed me the most. I made it out to Iguazu, I made it to Bento Gonçalves, and I'm now here in Porto Alegre. And the weather has been fantastic, the landscape has been beautiful, and the people have just been incredibly warm and welcoming. It's been a wonderful time.
Thank you very much.